Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have MEN2 syndrome. MEN2 syndrome is also called as Sippel syndrome. MEN2 syndrome or Sippel syndrome. Here the patient will present with main components of Sippel syndrome or MEN2 syndrome is the patient will have medullary carcinoma of thyroid, pheochromocytoma, parathyroid hyperplasia or adenoma is seen with Hirschsprung disease or cutaneous lichen amyloidosis is seen. So in MEN2 syndrome, MEN2A syndrome or Sippel syndrome, you will see there is medullary carcinoma of thyroid with pheochromocytoma, parathyroid hyperplasia or adenoma with Hirschsprung disease is seen and cutaneous lichen amyloidosis is also seen. Here in MEN2 syndrome, the main defect in MEN2 syndrome is presence of RET oncogene is the main defect, and this RET oncogene has a cysteine codon and it is present on the chromosome 10. So the RET oncogene is present on chromosome 10. It is an autosomal dominant condition.
thank you and thank you for watching.